Hi, good morning, everyone, and welcome to VYAPT Growth Series, Season 3, Episode 8. VYAPT Growth Series is a platform which promotes authentication of information, and we bring different growth narratives across various sectors and industries through various leaders. In our growth series today, we have with us Dr. Hari Prasad, Group Chairman of Care Hospitals. Dr. Hari Prasad is also former Group President of Apollo Hospitals. Join me to welcome Dr. Hari Prasad in VYAPT Growth Series.
Thank you and good
Namaskar.
morning. It's such a pleasure. Namaskar. It's such a pleasure to be on the VYAPT series.
Thank you so much, Dr. Hari Prasad. It's a pleasure to have your platform. And today I have a lot of curiosities, and I'm sure you would definitely feed our curiosities. So I'll start with the first one. There's so many hats you have worn. You being a, a doctor, you being also a business, having a business acumen in terms of the global growth. Also, you have always placed purpose before profit. So, in mind, we have our first question to we call it as our first curiosity. It's which strategies has been most effective in establishing a strong foothold for the healthcare industry?
Yeah, I think this is a very important question and something which is relevant in a country with the population that we have. If you go back 3 to 4 decades ago, the rich and the famous used to go abroad and get treated, while the poor we had no access to advanced healthcare. Today, we in India have the institutes which provide the best of care with outcomes which are comparable to some of the best institutions in the world. But I guess the real challenge that India faces today is accessibility. Accessibility both in terms of geographic access and financial access to good quality, high quality healthcare. When it comes to geographic access, 80% of the institutions, healthcare institutions, are located in the large metros and cities, while 80% of the population lives outside these large metros and cities. So the real opportunity for growth for healthcare is to get closer to the people and start facilities in tier 2, tier 3 cities away from the metros where the population really lives, and giving them geographic access is of crucial importance. I think Care Hospitals is very well placed in this because apart from one or two hospitals, a majority of the Care Hospitals serve populations outside the major metros in the country. And that's a strategy which has worked well, and I think it will work well going into the future. The next part of accessibility is the financial access. While we have great institutions, I think one of the most important things where there is a no compromise as far as healthcare is concerned is in terms of the quality of care and the safety of care which is provided to a particular patient. And quality and safety costs money. It doesn't come free. So when you are trying to provide good quality care in a safe environment, the people should be able to afford that sort of a care. And there is no reason why there should be an economic divide in terms of accessing good quality care. Therefore, I think one of the big and important things to do is to ensure that everybody has the financial access towards good quality care. And that is only possible with well thought out insurance, which is made mandatory for every citizen in the country and which keeps all the stakeholders happy. When I say all the stakeholders, it involves the government, both at the center and the states, the healthcare providers, both public and private, and the community. All of them need to be onboarded and all of them need to be happy with the solution that is coming up. This sort of a financial access is of critical importance. So further growth is is going to be based on creating this accessibility to good quality healthcare for every human being living in India.
That's so wonderful, and that's very good to know that care hospitals is actually, well placed to serve the people, those who are, do not get the actual, good kind of a good quality of treatment in tier 1 hospital. So obviously you are in tier 2 and tier 3 cities, so that's definitely will help a lot of people to get the quality treatment. So from this curiosity, I move on to the next one. Is and you talked a little around it, around the financial part of it. That how can we drive sustainable healthcare solution in primarily in tier 2 and tier 3 cities? And do you see any emerging trends that would drive growth in this particular segment, benefiting people through advanced care?
See, again, this is a continuity of what we spoke so far. One of the reasons why I say that India has got institutions which are capable of delivering outcomes comparable to the best in the world is that we have the technology also. An Indian doctor is respected across the globe. An Indian doctor is always known for his skills and capabilities. So there is no question about the availability of human resource talent to be able to deliver good outcomes. And the good institutions today have brought in the best of technology into the country, be it a robot, be it whatever radiation machines for cancer, the latest forms of treatment for cancer, everything is available in the country. And all this costs money, nothing comes free of cost. And what happens in the healthcare industry is technology is evolving very rapidly. New forms of treatment, new forms of diagnostics are becoming available at a very fast pace. And if we need to keep pace with the rest of the world, we need to be able to bring in this latest technology and make it accessible to the people. So profit is actually looked at, or margins are looked at as a bad word in healthcare in our country, which is not really a great thing. Because
True.
what happens, apart from the capital that is required to be to ensure that new technology is brought in, all the existing technology either needs replacement or upgradation in 4 to 5 years' time. So for a hospital to be sustainable, it should be having enough capital or enough cash generation to be able to keep itself abreast and to make sure that it is delivering good quality care and delivering the latest options that are available to the people. And I feel that, I always take this example of a mountain peak. If we feel that we've reached the peak, then there's only one way we can go, that is go down the hill. So I think what is required is the energy and the push and the momentum and the resources to continuously keep climbing the hill, because that's when you'll keep pace with what's happening across the world and the people will benefit at large. So while uh, sustainability, one of the important things is to make sure that there's enough capital infusion into the sector, into the existing hospitals and into new hospitals. And I think that's a very, very important factor which will make this sector sustainable. The second part of it is obviously we would need to make it cost efficient. Sustainability does not mean making it very expensive and out of reach of a common man. We would need to make sure that it is cost efficient. And I think some of the things that are happening in the last couple of years are bringing down the costs in terms of, in a large hospital, almost 60 to 70% of the material used, whether it's the consumables or whether it is the large machines or the technology, were always imported. And imported equipment are always more expensive. But I think a lot of thrust and push towards Make in India and utilization of Make in India products is actually something which will help us in bringing down the costs and making healthcare cost effective. I think therefore there should be a greater thrust on it. And one of the things which we look forward from the manufacturers, either of equipment, technology, or the pharma part of it, or the healthcare consumables, is to ensure quality, so that once quality is ensured and the healthcare providers develop confidence in the products that are made in India, I think we will be able to provide care in a more cost efficient manner.
Okay, so you talked about high quality at an affordable cost, so that a good quality treatment can reach to the masses, and that's what Care Hospital stands for. That's very good to know from you, and we will move forward to our next curiosity, which is around the diverse market segment. And you talked around that you cater to diverse market segment, and but when you talk around on a global scale, how do you see India becoming a healthcare hub? So we are already a pharmacy hub for the world. So how do you see India becoming a healthcare hub serving global audience for better treatment? And what is the local employment generation do we expect from this to happen?
I'll take the second part of it first. I think
Yeah.
healthcare is amongst the top employers in the world, irrespective of the technology that is coming in, irrespective of the automation that is happening, irrespective of latest things like artificial intelligence or whatever it may be. I think skilled human resources are critical for healthcare. And I think not just for providers, but also in the manufacturing sector, whether it's the pharma, whether it's the devices, whether it's the healthcare consumables. I think healthcare as a sector is the largest employer in terms of human resources. So the growth of the sector will further increase employment opportunities, and the thrust towards Make in India in terms of manufacturing, and the thrust towards Provide in India in terms of the healthcare providers will actually have a very beneficial effect on creating employment opportunities for the people. But the most important part of it is to make sure that they are skilled enough to utilize the new technology and to deliver the high standards of care that is expected from good hospitals. So I think skilling is a very important part of the whole process of employment. And apart from, when it comes to healthcare, people usually talk about doctors and nurses, who are the obvious and the most visible people in a hospital. But there are a large segment of people who work beyond the doctors and the nurses. This could be just the radiology technicians, the lab technicians. It could be a respiratory therapist, the multiple physician assistants. So there are multiple other people, other groups of people, or skill sets that are required to run a hospital. And I think it is these areas which need skilling, which people need to get into in terms of making themselves qualified and skilled to be able to deliver that quality of service to enhance their employability in the healthcare sector. So I have no doubt in my mind that the growth in the sector would actually increase the employment opportunities. Now, coming to India becoming the healthcare hub, in some form it has already become the healthcare hub. I actually started off by saying that 3 to 4 decades ago, the rich and famous used to go abroad to get treated, while an average Indian did not have access to good quality healthcare. Today, people from nearly 200 countries across the world come to India for healthcare. And the reason why they come to healthcare to India is, one, there is good quality healthcare, and two, it comes at a fraction of the cost compared to some of the Western countries or some of the so-called developed countries. So both quality in a cost-efficient manner is one of the reasons why India is looked upon as a healthcare destination for people living in almost 200 countries. And we are also beginning to see that as the number of people who get treated in India increases, the trust in the Indian healthcare system is increasing, and the word of mouth is becoming better in the international destinations, and that is actually pulling more patients into the country. So one of the things which we could do, which will help this increase many-fold, is to actually brand India as a healthcare destination. And this needs to be done by the government of India, where they work along with the other stakeholders like the providers and the doctors, the physicians, everybody, to brand India as a healthcare destination. Some of the countries have done it, like Thailand has done a great job in terms of branding Thailand as a healthcare destination and the largest number of healthcare tourists go there. But people who come to India are people who are coming for medical value travel. We don't call them medical tourists simply because they're not tourists. They're coming for a purpose. They're coming for a reason. They're suffering with something and they're coming for a major procedure. And majority of people who come to India are coming for serious conditions like a heart disease, or cancer treatment, or orthopedic joint replacements, or neurosurgery. So majority of them come to India for highly skilled services that we offer at good in a good cost efficient manner, and this is only bound to increase once India is branded as a global healthcare destination with the help of government of India, which it has begun. And I mean, once it really takes off, I think you will see more number of medical value tourists coming into the country.
That's so wonderful to hear from you, that more than 200 countries, patients come to India for treatment. It talks about the kind of quality which is available in India for healthcare treatment and all. I move on with this kind of a conversation which we had, which gave us an insight around the industry. Where are we moving, and what are the growth prospects coming in, and how people across the world can benefit from the kind of healthcare system we have here in India. I move on to our next round, which is called flip round.
Okay, you've been asking me questions about growth in the healthcare sector, and I think this is an opportunity for me to ask you a question. What are the major business transformations that are happening across the globe, and how is the thought process changing? This I'm not talking in terms of just healthcare, but across sectors.
See, in our that's a wonderful question, Dr. Hari Prasad, and I'm glad to know that you are actually thinking about not only healthcare segment but also different segments of business across the globe. That makes you a truly and a genuine leader. uh, in our experience, working with various clients across the globe, how the thought processes of the leaders and the shareholders is changing, that they're looking at more of sustainable solutions, and they're trying to invest more into emerging businesses, whatever businesses which can be more value to the clients and customers in years to come. So today they are spending a lot into emerging businesses, and more than that, it's also about innovation. So today companies are innovating a lot. They are spending a lot of money into their research and development. How can bring the cost of a product or a service to a sustainable level? If you look at, today's business is more to do how they can serve better to the masses, and that's what even you talked about in our short conversation. And that's where the global leaders are talking about how they can innovate to bring a sustainable cost to a product or a service. I think these are the top three things which the business leaders are looking at: sustainability, emerging business, and then innovate to make the things possible for a common man to have it be a product or a service.
So healthcare is no different. We've been discussing almost the same thing in the earlier period. That's a great
Very
answer.
true.
Thank you so much.
Thank you, Dr. Hari Prasad. We move on to our next round, which is called Learning on Go. So we talked about the healthcare business. We talked about how quality service is being given to the people in India, and how people across the globe are coming India for the kind of treatment they're looking at. Now I have a question, specifically for you. which is, you have been a leader for so many years. You have served some of the global brands, and now working as a new assignment, to take things at the next level for growth and also helping people at large. Can you narrate an incident which has been a source of abundance learning for you in your years of career?
Well, it's been 35 long years for me in this sector. And the thing which stands out for me is COVID. And I don't think there was a bigger challenge than COVID as far as the healthcare sector in the country was concerned. And I strongly believe that from every challenge, opportunities evolve, and a smart community or a smart institution makes best use of these opportunities which come in from the challenges. And I think COVID taught us a lot of things. COVID really taught us a lot of things, despite the stress and the pressure that we had during the COVID for lack of beds, lack of oxygen, lack of consumables, lack of medicines, multiple things. When COVID first struck us, we did not have a single uh, personal protective equipment which healthcare workers require produced in India. We always had to, import them, and it was becoming prohibitive, and it was not available because it was needed across the world. And I think that set into process a lot of innovation. And today, continuing with the example of the PPE or the personal protective equipment, we are, India is exporting the largest volume of personal protective equipment, which is manufactured in India and exported to the other countries. And that is the sort of transformation that opportunity is created. And multiple things have happened. For example, telemedicine was something which has existed for many, many years in this country, but very little was happening. But COVID made it come into the mainstream, and digital health is now rapidly becoming a dominant player in healthcare. So you don't need to go to your doctor for a common cold or cough. You can actually sit at home, talk to your doctor. He prescribes a medicine, and the medicines arrive at home, and you can be taking your medicines at home, and you can be monitored at home. So there are multiple innovations that happened during that period, which are now becoming a part of the mainstream. And I think that's the greatness of the challenge that COVID threw at us. And that's the greatness of the country called India, which took it as an opportunity and innovated and created newer solutions which have lasted beyond COVID and which are gradually becoming the mainstream of healthcare in terms of new forms of healthcare delivery for the community.
So that's a wonderful narrative, because you talked about that we change very quickly when there is a challenge, and that's why. So we adopted a lot of new things. We adopted technology, and you rightly talked about in the last 100 years we have not seen such a challenge, and I think in our lifetimes we do not, and we should not see a challenge like this in our lifetimes as well.
I really hope we don't see another one at all.
That's been a wonderful conversation with you, Dr. Hari Prasad, and thank you for coming on our platform and sharing the narrative which talks around the healthcare and quality service which can be given to the patients not only in India but across the globe. Thank you so much for being on our platform.
Thank you. It was wonderful talking to you, and look forward to work with you in some manner in the future. Thank you so much.
Thank you so much.